Okay, well, I'll go ahead and get started. So my name's Emily Edwards. I'm a medical student at Ohio University in my final year. I'll be a family medicine resident physician in about a month at the Cleveland Clinic Lakewood Center for Family Medicine. As part of our curriculum, we do a community outreach project and something we're passionate about. And I've always been passionate about adolescent mental health, so I chose to partner with Lakewood High School and put on a parent educational seminar on supporting your adolescent's mental health. Working with me on this project were Dr. Molly Wimbiscus. She's a psychiatrist that comes to the high school to see patients here as well, and Dr. Samuel, who's a family medicine physician who is here about twice a month seeing patients at the Cleveland Clinic here at the high school as well. So agenda for today, we'll talk about the importance of addressing mental health in adolescents and talk about the prevalence of the issue. We'll discuss the warning signs of depression and anxiety. We'll talk about how to help, how to have a discussion with your teenager or adolescent if you're concerned. We'll mention some community resources that are helpful. We'll discuss primary care's role in treating mental health conditions in adolescent population. We'll talk about the current screening guidelines, and we'll briefly mention some general treatment options. So why is addressing mental health in teenagers so important? So there's a lot of statistics out there. That's kind of why I wanted to give this PowerPoint presentation too, because we'll mention a lot of good resources that can give you good information that is relevant. But I think it's important to not doom and gloom on the statistics that much, but just to mention why this is so important, how prevalent it is in this population, and to really raise awareness to this topic. So I actually was able to find a local survey in Cuyahoga County that showed that around 36% of teens experienced depressive symptoms in 2018. According to the USPSTF, which is the United States Preventative Services Task Force, 7.8% of children and adolescents have current anxiety disorder, and about 8% report a major depression in the past year. Around 50% of mental health conditions begin by the age of 14 and 75% by the age of 24, which is why it's so important to raise awareness for this and address these things early. And in Ohio, rates of teen suicide have spiked over 45% in the past 4 years, which is a pretty scary statistic. These are the forms that I handed out, just a really good visual of the current statistics, kind of easier to picture. A lot of these I mentioned on the last slide. Some of them are more relevant to the past couple of years after the COVID-19 pandemic over on the right-hand side there. So you can see 1 in 10 people under the age of 18 experienced a mental health condition following a COVID-19 diagnosis. About half of young people with mental health concerns reported a significant impact after the pandemic, and about 1 in 5 reported significant negative impact on their mental health. This is another good visual from the CDC, the Center for Disease Control, kind of depicting the age group that depression, anxiety, and behavioral disorders is prevalent in. So as you can see, the age group of high school adolescents, ages 12 to 17, is the highest for depression and anxiety, which is why I chose these two specifically to talk about. So Dr. Wimbiscus has done a research project here in 2018 where she gave a lecture about mental health to the Lakewood High School staff, and she was able to conduct this survey asking the staff the 3 most important mental health concerns that they had for their students. And as you can see, anxiety and depression are in the top 3 of those, just showing how prevalent it is in this specific community. So kind of the big elephant in the room, I'm sure you can imagine that COVID has had negative impacts on the adolescent population as well as the adult population. So I did a literature review and found 2 systemic reviews done recently in the past 2 years that showed that, number 1, quarantine is associated with significant negative impact on mental health of children and adolescents, which might persist for months to years after quarantine. And another systemic review article showed that they are more prone towards high rates of depression and anxiety during and after the enforced isolation, which may last up to 0.25 to 9 years later. So after talking about the prevalence of this, talking about why it's so important to raise awareness, how this is so common in our community, I think it's really helpful to know those fast facts in case maybe your adolescent is experiencing this. It might be helpful for them to know that it's not alone, and it might be helpful for you to know that this is such a common thing that looking out for these early warning signs of anxiety and depression can be really helpful and beneficial to your child. So what are the early warning signs of depression? So some of the most common ones, you'll see it's a wide array of symptoms. So things like changes in sleep, changes in appetite and or weight, lack of concentration, loss of energy, lack of interest in activities, hopelessness or guilty thoughts, changes in movement, so either less activity or kind of ramped up, like feeling agitated, even symptoms such as physical aches and pains and suicidal thoughts or making suicidal comments. So as you can see, wide variety of symptoms, and some of these things even might be things that normal teenagers experience, like changes in their sleep. Sometimes teenagers tend to sleep more. They may have changes in their appetite and foods they like to eat. But I think the importance of keeping these in the back of your head is to notice sudden changes in their personality or sudden changes with these types of symptoms. And these can be really early warning signs for you to pick up. And we'll talk about having the discussion with your adolescent later on in the PowerPoint. And these are just some things that can point you towards something that may be going on with them. So, early warning signs of anxiety. So I broke this down into emotional and physical symptoms, as anxiety can produce many pronounced physical symptoms as well. So emotional symptoms are things like apprehension or dread, appearing really tense or jumpy, feeling restless or irritable, and starting to anticipate the worst and being really watchful for signs of danger. So you'll notice that they kind of seem like they're on edge, really jumpy. Physical symptoms can include pounding or racing heart rate, shortness of breath, sweating, tremors, twitching, frequent headaches, fatigue, trouble sleeping, and GI or gastrointestinal symptoms such as upset stomach, diarrhea, constipation even, frequent urination. So again, pretty broad spectrum of symptoms here, but noticing these rapid changes in either emotional or physical symptom, noticing a longer course of this. So if you notice them getting headaches more frequently, if you notice them kind of just feeling jumpy or irritable, like they haven't wanted to talk to you, they're getting a little more irritated with you recently, kind of keep these in the back of your head so you can notice the changes going on with them. And these are just some general mental illness warning signs that I pulled from NAMI, which is the National Alliance of Mental Illness. So just general warning signs. Some of these we talked about on the past few slides. Things like changes in weight and eating, throwing up, significant weight loss or weight gain, mood swings, use of alcohol or drugs, that's a new behavior for them, difficulty concentrating, worries and fears. And these things would be worries and fears that get in the way of daily activities like hanging out with friends or going to class. You can notice if they're starting to feel worrisome or skipping class more often or not hanging out with their friends as much as they used to. These are all some early warning signs that can point you towards some mental health concerns going on. So what can parents do to help? So number one would be educating yourself on these warning signs of mental illness, which is awesome. That's why you're here. Being aware of the community and online resources that are helpful for you, which I have linked some in this PowerPoint. I have a couple of handouts on these, and we'll talk about some of the more local resources here at the high school and in the community. Understanding that there are many types of physical health conditions, there are many types of health conditions, mental health conditions. So there's been a long-lasting stigma against mental health, especially in the adolescent population. And this is why bringing awareness to this and showing the prevalence of this in the population is so important. But there are many types of mental health conditions. There are things like depression, anxiety, which we talked a lot about today, but there are also things like ADHD, substance abuse, post-traumatic stress disorder, some other things we'll talk about later on. But they come in all flavors, so these early warning signs can be really helpful to point you towards something you think might be going on and then reaching out for help and determining further into that. So another thing is learning how to open the discussion about mental health with your adolescent, which we'll talk about on the next slide. Taking mental health concerns and suicide comments seriously. discuss your concerns with your child's primary care doctor or psychiatrist. So that would be either their family medicine doctor or their pediatrician. And then consider having your child scheduled with a counselor. Some things we are doing at our family medicine clinic right now are called HOPE visits. These are visits for anyone, but we've started doing them for adolescents too, where it includes one family medicine physician, one behavioral health specialist, and then the patient and or their family members or friends as well. And this entire visit, we talk about wellness and future-oriented goals, so things like nutrition, exercise, mindfulness techniques for mental health improvement. We can talk about different community resources, but it's a very positive, future-forward thinking visit. And we've shown a lot of success with that so far. So how to open the discussion with your adolescent. This is something that can be really challenging to do. It's not a discussion either party really wants to have, but it's a super important one. So we found it really helpful to have frequent short check-in discussions, such as maybe a couple of times a week, just for 5 minutes, just check in with them, see how their day was going, see if there's anything they'd like to talk to you about. And this really helps to keep the line of communication between you two open at all times. So instead of doing like a Friday night, really long, dreadful discussion on any mental health concerns you might have, or just any check-in concerns you might have in general, there might be some apprehension from either party to discuss their concerns or to feel like they have an open line of communication. So having these really frequent, short check-in discussions can help keep that line of communication open and have both parties feel like they're able to discuss their concerns. So when you're having this discussion, choose a safe place to talk, such as at home or in a private space, typically not in a public setting. Set some ground rules for the discussion, so things like only one person speaks at a time, no talking over one another. Set these right up front too. And then having low reactivity. So studies show that an emotionally charged discussion may not be well received for either party. So showing a lot of emotion, whether that be sadness, anger, anything like that. If you're emotionally charged, a lot of the times you won't actually hear what the other person is saying or really be able to express your feelings. Another thing is state your concerns. So if you've noticed some of those early warning signs of mental health conditions, you can go ahead and keep those in the back of your mind, jot them down. Make sure you state right then and there why you're concerned and give some examples if you can. Use open-ended questions. So we found it helpful, instead of asking, like, why are you so upset today, to ask what happened today. So leave the questions really open-ended for them to feel like they can kind of talk to you about anything. And then be present and reaffirm their feelings without judgment. Easier said than done, but goes back to kind of the low reactivity, just feeling like they're in an open and safe space where they can discuss your concerns and their concerns. And then reassure them that help is available. We'll go over a lot of the community resources in the area, and just let them know that you're an ally to them and there are a lot of resources in the community if needed. And then you can always use ALG for help. So this is a tool from the mental health first aid to help you navigate the conversation. The A stands for approach, assess, and assist with any crisis. So if you're starting to notice any of those warning signs, if they start coming to you for help, saying that they have some mental health concerns of their own. The L is listen non-judgmentally. The G is for give support and information. The first E is encourage appropriate professional help. And then E is encourage other supports. And these supports can be things like friends, family members, people in the school system, which we'll talk about in the next couple slides. So local community resources. So right here at Lakewood High School, there are a lot of staff on board that are trained to help with mental health conditions in your adolescent. So number one would be Michael Carr. He's one of the social workers here. He is also the mental health patient navigator. He can help connect your adolescent with local resources in the community, like counselors, psychiatrists, pediatricians, family medicine physicians, things like that. There are also other counselors here. There are family support specialists that can help navigate any familial problems going on. There are social workers, teachers, the principal, and there's also the school clinic here. I mentioned at the beginning that Dr. Limbiscus is a psychiatrist. She comes here about once a week to see patients. And also our family medicine clinic comes here about twice a month to see patients too. And we're able to screen for mental health conditions, set people up with resources, begin treatment, things like that. Always feel free to talk to your family medicine physician or your pediatrician about any of your concerns. If you don't have one of those, the Lakewood High School staff would be really helpful in helping direct you to that. I know Michael Carr has a lot of the local providers here. Psychiatrists or psychologists. Some other local resources are organizations such as Signature Health, Guidestone, and the NAMI of Greater Cleveland. And some really helpful online resources that will give you accurate information are NAMI, SAMHSA, which is the Substance Abuse Mental Health Service Association, the NIMH, which is the National Alliance of Mental Health, American Foundation for Suicide Prevention, Youth Mental Health First Aid, which is where that algae mnemonic came from, and the National Center for Wellness. And I have all of these linked in the PowerPoint as well. So primary care's role. So these would be either your family medicine physician or your pediatrician. Like, what is their role in diagnosing and treating adolescent mental health concerns? So primary care physicians work right alongside of psychiatrists and psychologists to diagnose and treat mental illness in adolescents through some of the following. So at well child visits, typically we have well child visits up until the age of 18, usually yearly after the age of about 5. So at those visits, we usually screen for depression and anxiety at the correct time. We'll go over that on the next slide. We can screen for things such as attention, ADHD. We'll screen for substance abuse, complex mood disorders, post-traumatic stress disorder, and ACEs, which are adverse childhood events. These are things such as physical or sexual trauma, death of a loved one in the family, things such as health disorders diagnosed in either the adolescent or one of their family members, such as like diabetes, heart disease, something that can be traumatic like that. All of these have been shown to have significant impacts on mental and physical health moving forward from adolescent. The primary care physician can help to open the discussion with the adolescent and build a long-lasting rapport with them. So typically at these well child visits, we will have the parent or guardian step out of the room for a few minutes so we can have an open discussion with the adolescent about any of their concerns or questions they might have. We can see if it's appropriate to screen them for certain things such as substance abuse or mental health disorders. And we always let them know that the information discussed is confidential unless there is concern that they will either harm themselves or someone else. But other than that, the information we discuss is confidential, and that really helps to build a long-lasting relationship with them. PCPs are also the bridge between primary care and psychiatric care. We are able to diagnose and treat many mental health conditions, but sometimes specialist help is needed. We can initiate an appropriate treatment plan. These are things such as either referrals for counseling, if you need therapy, appropriate medications, mindfulness techniques. We provide anticipatory guidance for parents and guardians, and we have microtherapy sessions, which are kind of exactly what they sound like mini therapy sessions talking about any concerns they might have. We can talk about like mindfulness techniques, coping mechanisms, things like that, just little short therapy sessions. And then hope visits, like I mentioned previously. So current screening guidelines, this was actually just updated a few weeks ago. These are from the United States Preventative Services Task Force. So they recommend screening for depression in adolescents aged 12 to 18 years. So at most clinics, pediatrician or family medicine, at the age of 12, we will immediately start screening for depression. Typically, if it's normal, you don't need to screen every single year, but starting at 12, we start screening. So screening tools are things like the Patient Health Questionnaire for Adolescents and the Beck Depression Inventory Scale. These are standardized scoring systems that help us to determine if we think there needs to be further evaluation. They're not diagnostic tools in themselves, but they ask questions such as, in the last 2 weeks, how do you feel like you've been affected by these certain things? So it's like, not at all, every single day, half the days, nearly every day. And we ask questions such as issues with sleep, feeling hopeless. There's about 12 questions, it gives you a score up to 27. And then for anxiety, the USPSTF recommends screening for anxiety in children and adolescents aged 8 to 18 years. This actually just changed a few weeks ago. It used to be 12 to 18 years as well, but due to the recent increase in anxiety possibly post-COVID pandemic, they recommend now starting at 8 years old. And similar to the screening tools for depression, these are things like screening for child anxiety-related disorders, or the SCARED scoring system, and then the patient health questionnaire. So general treatment options, treatment choices for mental health conditions really vary from person to person. Someone can have the exact same diagnosis, and they will have different needs, experiences, goals, and objectives for treatment. So there's no one-size-fits-all treatment, but I did want to mention a couple of the general options out there. So psychotherapy, including cognitive behavioral therapy, family-focused therapy, and interpersonal therapy. So psychotherapy is pretty much just talk therapy, and family-focused therapy sessions, like I talked about before with the Hope Visit, you can have multiple family members come in. Other treatment options include medications such as antidepressants, mood stabilizers, antipsychotic medications. Again, very person-to-person based, diagnosis-based treatments. Exercise has been proven to help with mild to moderate symptoms and actually proven to prevent mild to moderate symptoms of anxiety and depression. Light therapy, which uses a light box to expose a person to full spectrum light to regulate the hormone melatonin for sleep. This can be helpful in seasonal affective disorder, which is in places like Ohio when it gets very dark in the winter months. This helps us to continue producing the hormone melatonin and can help with things like sleep and mood. Alternative approaches include things like acupuncture, meditation, faith, nutrition counseling, sleep counseling. These can all be a part of a very comprehensive plan. But again, very person to person, but just so you know, there are a lot of treatment options out there, not just medications, not just therapy, but a lot of comprehensive treatment plans that can be put together dependent on the person's need. And these are some helpful online resources that I mentioned before. I just wanted to put the link in there. These will take you to specifically the Adolescent mental health page. In these resources, you can find things like mental health fast facts with accurate information. You can find different community resources. NAMI has a greater Cleveland branch that has a lot of resources there, counselors, psychologists, psychiatrists. Mental health first aid has a ton of resources at home. They even have resources on how to have the conversation with your loved one. So things like using the mnemonic algae. All of these have awesome resources, not just for mental health fast facts, but also information to educate yourselves on the different types of mental health concerns too. And that is it. Any questions at all? Yeah.
I didn't want to jump right in, but maybe
Sure.
others would like me to prime the pump a little bit. So I have an observation, something to add on, and then a question also.
Sure.
Emily. Back on the, I forget which slide it was, but, I need a note, because it was on the how to open the discussion
Sure.
slide. In fact, before coming in here, I was talking with a couple of parents about how, kids of any age, and in fact adults, they're more likely to do what we do rather than we say what we say, right?
Yeah.
And so how to open the discussion, I absolutely agree with everything you have there. And I wondered about the possibility of, even before it's time to open the discussion, kind of modeling, if it's an adult, a parent with an adolescent, like if I'm having some kind of a difficulty, not one that I'm pretty balanced about, I think it would be pretty helpful, wouldn't it, to be saying wow, I really was thrown off by something that happened at work. I haven't been sleeping. My appetite is gone. Sure. I think I'm going to make sure I take 2 walks in the evening this week, and I'm going to make sure I go to yoga class. Really talk through, I'm feeling this, I'm feeling that, I'm going to do this, and yeah. By kind of confining that managed thing to the adolescent, it kind of models how this kind of conversation can go with that, and you could even maybe say, I'd love to hear the same kinds of things from you. It will help me feel supported in my journeys, So we're not laying heavy things on kids. We would want to model our successful dealing with stressors. Would you agree that that's kind of a good backup to this discussion?
Yeah, that's an excellent point. I think kind of modeling that, not only that they're not alone and that you go through similar things as them, whether that be having some feelings of anxiety or depression, or even just things like trouble at work, trouble with a friend or family member, and then modeling your own healthy coping mechanisms and modeling that it's okay to discuss these things and it's healthy to discuss them. I think that can be really helpful as well. Thanks for adding that.
Sure. And then my question had to do with the screenings
Yeah.
that you're doing in the office.
Sure.
I was very interested, of course, as a school person, to hear that the screening age for anxiety, that your standards would be to now do it closer to 8 years old, which is more like a second or third grader than like a middle schooler,
Right.
which is where it was before. That's very interesting to me as we look at how we're handling these things in the district.
Right.
But my question is, do you typically, if it's an office visit, would you typically do that via structured interview, whereas we might put an actual form in front of a student or have something online? Do you just do it through more of it appears like the other questions that you're asking, but you know that they're the ones on the PHQA? How does it work?
Yeah, so it kind of varies provider to provider, practice to practice. Sometimes offices will have the adolescent fill out a form, so we'll give them some privacy in a room to kind of fill that out with the rest of the paperwork, such as like a review of systems, like do you get headaches, fever, fatigue, so they feel like it's one comprehensive review of what's going on. However, there are some providers that will do it right in the room. Some providers will show the screen and show them exactly what they're doing in the scoring system and explain what's going on. Some will kind of just bring it up in conversation. I think it's kind of a feel it out on the basis of the patient kind of thing. There's no standardized approach to these screening methods. In our office, personally, sometimes we have them fill out the form at the first visit, so either 12 years old for depression or 8 years old for anxiety now. We'll have them fill out the form with the rest of their health questionnaires. But then on after that, we'll sometimes bring them up in casual conversations we're having with them. If we feel like they're pretty involved and knowledgeable in their mental health, we'll show them the questionnaire we're doing and kind of explain it to them so they feel a little more connected to you. But it's really all about building that rapport and that trusting relationship.
Thank you for kind of pulling back the curtain on that. It's helpful to hear the different ways and how you choose how to do it.
Sure, yeah. Of course. I was also super surprised to hear about the anxiety age change. This just happened a few weeks ago. I was talking to Dr. Saniel about it, and we both received the email about the update. And I wouldn't say it's exactly surprising, as we've seen a lot of increase with anxiety and depression in teenagers. There's been, I think, around a 40% increase in hospitalizations and ER visits for mental health the past couple of years. So, but we're glad that that's being reflected in screening guidelines and that we can hope to address this earlier.
Yeah, we're definitely seeing those things anecdotally here in Lakewood City Schools, and glad for the partnership to support our kids and families.
Yeah, well, thanks so much for your questions.
Yeah.
Anyone else? Sure.
Mine's a little more of a story and then a question.
Sure.
If I may, I had quite a journey with my own daughter, who is typically a very happy, amazing child. She's a little bit of an overachiever, but it took about 4 years to diagnose her with anxiety. Her symptoms kept coming out in a physical nature. It started with a finger tremor. It would just, shake. It was just like, why is my pinky shaking? I feel fine. She would get very nauseous. She would get carsick, which we related to motion sickness.
Sure.
She got tested for vertigo. We went to specialists. Then they said, oh, we think you're getting migraines. Then she had a brain scan. It was test after test.
Right.
It gets very expensive. I was fortunate to have good insurance to continue this journey with her. Then we discovered that it could be anxiety. And I was like, really? And she was even like, this can't even be possible. I don't feel anxious. But there was something within herself that it indeed was, because once we found a counselor and a psychiatrist, she ended up having to go on medication through this journey. We tried without for a year, and then she needed it in the end. My question after my story is, how do families afford this? Are there options for families that don't have insurance, can't keep up with the testing, if it's not as simple as, wow, you seem anxious, let's get you care? And then, they would call different counseling services or the Cleveland Clinic or whomever. But when you're going down a different journey, as I did with my daughter, what does a person do? How do families hang in there? Where are the resources then?
Yeah. I'm so sorry to hear that your daughter had that experience going through that diagnosis. I'm glad she got the correct diagnosis at the end and to hear that she's doing better. Unfortunately, that's not really an uncommon type of story to be diagnosed so late and to get a very expensive workup. And I think that that's why bringing awareness to community resources is so important, to get these resources out there right away, to let parents know about the warning signs really early, because like I mentioned, the physical symptoms of anxiety, sometimes people only present with physical symptoms, which is why I made a point to mention them. But I think that education is probably one of the biggest steps in that direction, to really focus on letting parents know the local community resources. I know such as like Signature Health and Guidestone have options for families without insurance. At our office, we typically break down like counselors and psychiatrists by the insurance they have, just to make sure it's absolutely covered, because we completely understand the cost that comes out of healthcare as well, especially if you've already gone through an incorrect diagnostic workup a few years before that. I totally understand that it gets expensive. Unfortunately, our healthcare system is just very flawed at this point, and that's why in our education now, in medical school even, we start to learn about the system side of healthcare. We start to learn about the insurance side. We learn about inappropriate diagnostic workups. This is why we have continually developing screening guidelines to kind of warp to what is going on in the community, like decreasing the age of anxiety screening, because we notice it's more prevalent now. So it's kind of just a work in progress and continuing to develop. We start to involve our younger generation, such as our medical students, our young residents. I know our residents go through specific adolescent mental health training. So it's kind of all about education though. This is why we go out into our own communities to talk to parents, to hear their stories and hear their concerns, and that helps us to change the ways we practice as well.
Is there a way that the school or community could help families understand that there are resources? Like, don't just not try,
Yeah.
you know, that there is help, whether you don't have insurance, whether you meet these income guidelines. Don't be afraid to ask.
Right.
And say, we're struggling or we're going through this, you know. Does the Cleveland Clinic at the high school present it that way with families?
Yeah, so I'm not sure exactly how the high school presents that stuff. I know luckily Lakewood High School has a lot of mental health resources, and they throw events like this pretty often to include the providers in the community so they can educate parents on the resources. I'm not sure of the standardized process, but for us personally at the clinic, this is something that we're looking into. So we look at this kind of seminar to be an opening seminar. We hope to expand this education for parents to the other local schools. I know Strongsville's been asking us about that. I think even doing maybe some online seminars might be more helpful in case parents can't make it. I thought about doing like handouts on the local resources in the community, and maybe just even mailing or emailing them out to all the parents at the high school so they have them right away without kind of having to ask for them. So there's kind of a lot of things that we've been thinking about. I'm not sure if you can answer this, the standardized process at the high school.
Yeah, I think the only thing I would add is probably like a first thing could be to really encourage families to get that annual well child check. And there are definitely ways for uninsured families, you know, through Medicaid or other ways that they have access either to the Cleveland Clinic Health Center here or through Metro. You know, there are definitely places where kids can get a well child check. And by doing that regularly, and with what Emily's saying about pediatricians and family medicine practitioners understanding how to screen for these things, that the more there's good information happening at that routine visit, then that's going to hopefully put folks on the best track for figuring out anything. So I think getting to the pediatrician or family medicine specialist is really the first step, because so many families who are underinsured don't do that. So it's only like crisis care for health problems, and then missing that opportunity. So it seems to me that at least that would be a step, and then establishing that rapport and getting to know. So we do have ways of getting that type of visit for students right here at this building. So probably a better education campaign within the district to have more families doing that would be a great first step toward solving some of those things, I think, and it's very accessible to us within the scope of a healthcare system in our country, which is not functioning well for folks who don't have resources.
Absolutely.
So, yeah.
I was just going to add to the conversation. I'm in med school as well, and that's like the nail on the head. And it was also like music to my ears because I want to go into primary care as well. I mean, the screening guidelines are in place as a result of these things sometimes being hard to catch. And, you know, because anxiety has a lot, I've seen it myself, has a lot of physical manifestations. They get all this testing, and it's like, you know, do they have a screen in there somewhere? And the answer is no. So if you go to that annual visit and they're doing those those screens every year, you know, the majority of people, it's probably going to be negative. They're probably going to be healthy, they're going to be fine, no big deal. But for those people that, you know, you're like, you know, you have a couple positives on the screening test, and then they say that, you know, they have all these other symptoms, and you're like, then you start thinking about it. As a physician, that's how you start thinking. And so that yearly visit makes a big difference. And, you know, the primary care visits are much cheaper. Generally, they're not going to order a bunch of testing and stuff unless it's absolutely necessary. So I think stressing that importance is a big deal. And I mean, I can speak from my own experience. Like when I was in high school, I think I went to the doctor like a handful of times, you know, so it seems silly. You're like, oh, I'm not sick, you know, my kid's healthy, but like, yeah, you should probably go to that yearly visit. So it's kind of an important thing to stress.
Yeah, and that's a good point. I talked to a few of the staff at Lakewood High School too about possibly sending out just information about the clinic we have here and all the resources we have here, because if we can get you through the doors of the clinic, uninsured, insured, there are so many resources in especially the Lakewood community. So just being aware that you have help, whether that be from teachers, counselors, medical staff, nursing, anything. I mean, helping you get through that door, I think, would be helpful. Would you think that having something like sent out to the parents to be aware of the resources here at the high school and here at the community would be helpful?
I do.
Okay.
Other than just the annual packet that comes home
Okay.
in the mail, because I'm like, oh, I have doctors. So for my children, so it winds up in the garbage.
I think the way they send out the packet is very confusing.
It is.
Because it comes across like, to your point, well, since I have a doctor, this isn't for me. And so it doesn't come across as, this is for everybody and here's how it could work for you.
And this is what we can provide.
Yeah.
I don't see that in that information.
It doesn't come across
The
that way.
messaging needs to be updated and simplified,
Yeah.
I think, in terms of what we send out now.
Yeah, I think that's a great idea. And that's
Yeah,
something I
it
can
might
always
just be
work
like, instead of that big packet, like just more of an info sheet
Yeah.
about these are services to the community.
Mhm.
And then when you get the resources that want to partake in it, then you can give them the layered information to fill out.
I think one more thing to add to that, I'm sure a lot of high school students don't know, is that we are legally bound to privacy for them, so we cannot tell their parents anything that they tell us if they don't want us to, unless it involves harming themselves or others. So I think that is extremely important because they may be a lot more willing to go to that annual visit and take the 15 minutes to go talk to someone about what's going on, because they know that we can't tell anyone. So like I said, that's a legal thing, so we can't even even if we wanted to, we can't. So
Yeah, and that kind of goes back to keeping like an open line of discussion, kind of modeling the behavior of talking about mental health or really any health concerns or emotional concerns. And they may even model that with their physician too when they go to visit.
Is the Cleveland Clinic at the high school year-round, even though we get out for summer?
Yeah, so we're currently here twice a month. It used to be only once a month, so we've been fighting to kind of come here more often. So the Cleveland Clinic Lakewood Center for Family Medicine is a residency-run kind of program. So we have 3 classes of residents, and usually 1 or 2 residents comes out here the 2 days a month that we're here to see patients, whether that be like sports physicals, just general health physicals, mental health screenings, things like that. But we've been fighting to come here more than that even.
And I
once
think
a
our
week.
nurse practitioners here every day.
Yep.
Yeah, so the clinic is open.
So is this something, I'm sorry.
No, you're fine.
We have the Three Arches Foundation now.
Mm.
Is this something that maybe a grant, we could submit a grant to maybe cover the cost of well visits at our Cleveland Clinic facility for parents to come in and start establishing that relationship and really understanding what resource we have here at the high school.
Mm.
And that way, it would be no cost, it would be a free screening, maybe some parents, that would be a really viable, intriguing option for them, and they might take that first step.
I can speak to that a little bit. Right now in Lakewood, and many of you may be aware that there's a community health needs assessment, a CHNA, going on in the city of Lakewood. And they've involved our school district as partners. I'm sure they have many, many other partners. That's just my only window into that. And it's right in the name, a health needs assessment for our community. So I know I can talk with you. Someone in our district is on the advising board for that assessment. And so let's make sure that that idea kind of rises its way into what they're looking at, because you know, obviously we've kind of even established just in this group today what an important thing that would be. So let's make sure that rises to this document that the mayor and the council will be looking at in order to guide what's happening in Lakewood over the next, future years. So it's a great idea.
Yeah, I think that's a great idea. Any other questions or comments or stories?
So a lot of this kind of focused on more diagnostic, like assuming there's a problem, but what about like, are there things that can be done? Because I feel like I'm having a hard time relating to the way, like the pressures of life that are being put on our kids.
Mm-hmm.
And I also have a child who has a very different personality than me, who's like super chill, but sometimes so it's hard, like, some of the things you described, like he's been withdrawn since he was born.
Mm-hmm.
So how do I, I guess, how do you support mental health and make sure that they actually are like mentally healthy, as opposed to just assuming it's all, it's depression, anxiety. That part I wasn't as clear on.
Sure. So I think some of like the more preventative kinds of things. So I think opening the discussion doesn't have to be only when you notice a problem. So those short, frequent check-ins just about how they're doing in general, I think that can be also more of a preventative thing. Sorry if that didn't come off super clear, but having those discussions just regularly and having that open line of communication so they kind of trust you, feel like they could say anything to you if something were to happen, even if it's not happening right now, can be really helpful. I think modeling that behavior too, kind of about like, oh, I had a really bad day, why don't we, go for a walk or go for a jog, like modeling more coping mechanisms that are healthy, things like that. These are all more like preventative measures to take to kind of avoid depression and anxiety or avoid mental health concerns. But I think also those well child visits are going to be super helpful for preventing any kind of mental health disorder, or at least catching it very early. So I know we go over like anticipatory guidance for parents or guardians, so we can talk about things to do now to keep the adolescent healthy, such as things like nutrition, exercise, social life, like having friends and family support, getting out in the community, like things like screen time, things like that can be more of like anticipatory guidance to kind of keep the adolescent healthy when they're feeling healthy, and then just establishing that line of communication so they feel like they have multiple people in their life that they can talk to if something were to go wrong. So I think, does that help?
Yeah,
okay.
Makes sense.
Okay. Sorry, long-winded question.
I have another idea to throw in there for maybe a more introverted adolescent who doesn't want to like talk with mom or dad or other people about things. I've heard people having great success with just having a journal like a notebook that just sits somewhere. And you have an expectation with the student, like on Fridays, you're gonna put something in this journal and I'm gonna write back to you by the end of the weekend or something. So it's just like a check-in that isn't like sitting knee to knee, like, how are you, honey? If that feels just totally awkward. Is this another way to have that like check-in without it being really awkward if that's not their way?
Yeah, he hates writing though.
Well,
There's a way I can do that
maybe it's
now.
graphic pain that he draws a picture in or something.
Yeah.
I will say that my little brother, like growing up, he was very withdrawn, like the opposite personality of like all the people in my family. And one thing that I thought was interesting was that like I just said, oh, how are you feeling? Like, how are you doing? And he would not care. He would not respond. He was a typical teenager. But then I wouldn't really get anything out of it. But I guess over time it made him feel like, oh, if I do have a problem, like I can reach out to her or something. Because like he reached out to me like a few months ago to just be like, oh, can I talk to you about something? And so I guess it just built it. And it's like I wasn't getting what I wanted because I was like, I want to talk about feelings all the time. Like, tell me how you're feeling. But when he wanted to, he knew that he could reach out to me, and I guess like building that is also really important.
That makes sense.
Yeah, and to add to that, sometimes some mindfulness techniques we go over, like journaling and things like that, we'll go over just at an average visit too. We'll talk about things to do just when you're stressed, not if you're feeling anxious or depressed, stressed with school, stressed with friends or relationships, and we'll go over things like 4-7-8 breathing, journaling, taking a walk, exercising, just different kinds of mindfulness techniques just to deal with kind of the everyday stress of being a teenager too. So that can also be really helpful. Any other questions? Well, thank you guys so much for coming. I really appreciate it.